Your widespread joint pain that you have could be due to perimenopause that you don't even secretly realize is happening to you, because early perimenopause does not have the symptoms of menopause that you think of. So most people think of menopause as basically I'm skipping periods and it's hormones and it's just my periods. No. Your estrogen, as it declines, along with progesterone, testosterone, and all sorts of fun that happens, is really important to a lot of things in your body. Estrogen supplies many systems in your body. For instance, your brain, your heart. It affects your muscles and bones. So your widespread joint pain that happens in early perimenopause, which can happen in your 40s because the average age of menopause in the US is 51, 52, menopause can start 7 to 10 years prior. You could be 41 and in perimenopause and not even know it. Now, this kind of explains why maybe you feel less motivated to move. Maybe you feel more snacky. Maybe you feel like you're doing the same exact thing. You're gaining weight in your belly. You're gaining visceral fat. You also notice your joints are stiffer. You're more likely to get tendonitis. Maybe you suddenly got frozen shoulder. Maybe your hips are hurting. Estrogen also helps you deal with inflammation, so you're a little more inflamed. If you are doing the same things before but not doing more recovery, you're more likely to have some chronic tendon issues. So we start to change how we do things, and this is coming from me, a women's health physical therapist. I am telling you to change your habits, such as we need to do more mobility. My request is for women to start thinking about doing 10 minutes of mobility a day. That can look like something like 10 minutes of yoga. I usually suggest sun salutations. It could be your specific mobility routine from your physical therapist. It could be from cars, pails, rails. There's a host of mobility things that you can do. I then would tell you, because we are more inflamed, we need to nourish our bodies and make sure we're taking care of ourselves. We need to sleep more. We need to make sure we're hydrated. Yes, electrolytes make a difference. You can be good to you and take a breath, because we are constantly living in that fight or flight because you're the sandwich generation. You can't heal. Your brain doesn't know the difference between your physical stress and your mental stress. If you want to make a change, hit the plus sign, follow along, and learn with me, because I want to teach you the science of women's health, how your bodies can be optimized, because I want you to feel better, because I know you don't feel good. Love you, bye.